The overload of information on the coronavirus can be very overwhelming, especially for those who are doing their best to stay safe while following the health protocols in the various territories. Persons who have recovered from the deadly virus are open and willing to share their stories in an effort to help others. Health workers continue to go above and beyond, while governments and civil societies continue to place emphasis on protecting the populace. Physical distancing, the wearing of masks, and proper hygiene is the new normal. We are coping with COVID-19 in the Caribbean.
In the COVID-19,
like leading
social distancing.
Recorded one. Spoke to journalists from St. Lucia, Antigua and Barbuda.
There is no need for fear or panic.
Meet Denarii, an Antiguan living in the United States. He contracted COVID-19 and has since recovered. You see, Denarii, unfortunately, was one of those who believed COVID-19 was fake. He shares the events of his ordeal with us.
When COVID was happening and everything was going on, I was an ignorant young man. I was one of those kids that didn't pay attention to nothing. And what is COVID? COVID fake. COVID, I was one of those that talk like that, so I want to say that firstly. When I first got the symptoms of COVID, I was in denial of that COVID was there. Felt sick, thought it was just fever, thought it was just a regular, I'm down today, just relax and everything. So I called in sick and everything, I just, let me do natural remedies and stay at home, drink tea, relax and just cool. And I started to become even more annoyed at the fact that I was sick, getting sick. So the more annoyed I got, the more I didn't do nothing. So me being uneducated to it, not listening to the news, not listening to nothing, I was just like, I will get over it.
The reality of COVID-19 begins to sink in.
When I first got the symptoms was April 3rd, I think. I got the symptoms, which was the regular stuff that you hear all the time, which is headaches, and started to feel the fever, temperature's 105. You know, those are stroke-like levels. Those are, boy, you're really hot, cool down. Those are the levels that you need to get underwater immediately. So I was definitely hot and everything. I started to feel even more aggressive and stuff like that. So I started to get up and I say, let me take my time up and go to the hospital. Went to the hospital after getting it and I got discharged.
Denarii was not admitted to the hospital because his symptoms did not appear to be that severe. He was given medication and sent home. Over the next few days, he would see an escalation in his symptoms, including paralysis, extreme fatigue, and loss of appetite. So he went to the ER again. He was sent home once more. The next day, he received a call from his doctor.
I got a phone call around 10 in the morning from my cousin who was a doctor. And he did a general analysis of how I was breathing. Because he's a doctor, he knows that if you reach too far, it attacks your breathing, and that's when it gets serious. So he said, "Cuzzo, you ain't breathing." I said, "I'm breathing, man, I'm good." Ignorant again. Same time he told me that, the doctor called. No coincidence, I won't lie this on nobody. And I tell you, straight up, the doctor called and he said, "Yeah, you test COVID positive, isolate yourself for 14 days and blah, blah, blah." They were just saying all these things that is currently said in the media now. Isolate yourself and blah, blah, blah. My cousin came on the other side and said, "No, go to the EMS, go to the hospital now. Don't drive, don't nothing, go in the EMS, go in an ambulance."
Denarii's life was about to change. The reality of COVID-19 had magnified.
This is the step when I realized this was real than real can be. This is where, boy, everything you were hearing on the news is true, People are really dying. I don't know how dying feels, but this is close enough for me. That's when I started to realize everything is real. I started to say, boy, this is really happening. Doctors were moving fast around my door. I'm trying to pay attention, hearing Roberts outside, Roberts out this, Roberts outside. Roberts, you gotta go, you gotta get transferred. Put me back in the next ambulance, they speed me down the highways, hearing everything outside and start panicking again, let's breathe. You're gonna be all right. Talking to myself. You're gonna be all right. This okay. I went inside, they're busting out the doors just like the movie theaters. Just like in the movies, I kid you not. Burst open the door, boom, boom, boom. Immediately in the surgery room. They didn't ask nothing. They pushed me in the surgery room. Roberts, put oxygen on me. The ventilators and stuff like that. They put it on me, first time they put it on me, I sniffed hot air, kid you not. The air was so hot. The air was so hot that automatically water started running from my eyes. It was hot that I couldn't, this is me breathing.
Unable to breathe and coupled with the fear of the unknown, Denarii is swimming in COVID-infested waters.
Everybody's around me, there's 5 doctors around me and stuff like that. So I'm like, this is really bad. I started to say, man, is this gonna be it? Is it really gonna be it? I'm gonna die without even getting a chance to fight this stuff?
Denarii is now dependent on the decisions of the doctors and nurses. He describes his hospital debut as a scene from a movie. He's holding on. And the superheroes, the frontline healthcare workers at the hospital in Boston, they are doing their best to keep him alive. In Antigua and Barbuda, the doctors and nurses are doing the same with the pandemic, despite the challenges. Nurse Dupi Winston, president of the Nurses Association, tells us how they are dealing with the structural issues related to COVID-19.
I must say it has been very challenging. There was mixed feelings among the nursing profession and other healthcare workers. The bare fact that COVID-19 is something that is new, and the dynamics of COVID-19, it was not well known. There was some fear and concerns among nursing personnel. However, I must say, some persons figured it out and they continued to work. Others, because of health reasons, they had to be put off on leave because they would have been at risk because of whatever comorbidities they may have had at that time. The issues with PPEs at first was there, but that has been corrected since. We would like to see a constant supply of PPE going forward because we're still swimming in waters that we're not sure of what is going to happen as the country opens up, but we have to be very cognizant of the fact that COVID-19 is here and it may be here for quite a while.
The Chief Medical Officer, Dr. Rhonda Seeley-Thomas, is pleased with the response from the medical fraternity.
From a Ministry of Health point of view, from the time of lockdown, I saw a really coming together of some critical healthcare workers to stop the spread of or the impact of COVID-19 in Antigua and Barbuda. That's the main thing that I saw since the lockdown from a Ministry of Health point of view. I really saw a lot of healthcare workers really marshalling forces and protecting the nation, and I want to take this opportunity to thank them for that.
I must say some nurses have stood the test of time. They have doubled up. They have decided to help in whatever way they can to ensure that we do our part in keeping Antigua and Barbuda safe.
The president of the Nurses Association follows up on the importance of support.
But I must say the nurses have been very encouraging. The general public as well has been very encouraging. The show of support that we see coming from the general public our families, our church members, even the ministries, we see it a bit more overwhelming than before. I don't know if it's because of this time and also because this year was declared the year of the nurse and midwife by WHO. But I realize that now that they're seeing the important role, the pivotal role that nurses play, especially during times like these. And if the nurses were to withhold their service, then we would have been in quite of a quandary. So the support is there, and I must say, I think once you have a good support system behind you, as a nurse, you definitely will be able to make it during these challenging times, especially mentally wise, yes.
A lifeline, that's what they are. The doctors, the nurses, all the healthcare workers. One can only imagine the levels of anxiety and stress these individuals have to deal with on a daily basis. Yet they continue to put us first. Denarii is out of ICU. His doctor is his lifeline. He's overcome by a whirlwind of emotions.
I was in the observation room and I was getting mad at everything. I was mad at the fact that I had money in my bank account. And you must wonder why I said that. Because all my days of my life I was taught just to be able to work and provide and have money, because that's what we all chase right now, to have money and stuff like that. And I was mad at the fact I had money, because money couldn't help me. There was a saying all the time, people say all the time, like, yo, they say all the time, poor people die the same way as rich people. I never believed that saying until I was in the hospital, dying, basically. That I had money in my bank account, and that doctor came in every day with just the care in her heart to help me. Never even thinking about asking me for money. Never even think about taking everything I had on me. Nothing.
Denarii praises his brother Menace for being there for him, even though he was 1,700 miles away. However, the mental warfare is raging. Denarii is tired.
I remember a night came when I just hung up the phone with him. And I was there, and it was like 12 o'clock at night. And this was no ordinary night. It was just a night that I said to myself I was tired. I kid you not. I was in the bed and I said, I'm tired. I said, Denarii, I'm tired. I need to sleep. That's the first time I ever told myself I need to sleep. Keep in mind, I was going to sleep. I was not ordinary tired, I tell you. I was just relaxing, getting ready to go to sleep. And this was the best sleep I was gonna get since I got into this place. I want to know the seriousness of the situation. What's the best feeling of me going to sleep? So I said, I'm gonna go to sleep now. And I leaned back on my bed and I started to close my eyes. I felt so good. I heard my door, bang! My door pushed right open, boom! Roberts, breathe, Roberts, breathe! I swear to God. She came in, breathe, Roberts, breathe. Breathe, Roberts, you're not breathing, you're not breathing. I'm like, I'm breathing, I'm breathing, I'm breathing, I'm breathing. I'm breathing, and, oh shoot, I wasn't breathing. I was going into sleep. I was really tired. I was going into sleep. And she said, breathe, Roberts, breathe. Breathe, Roberts, breathe. And I'm there, breathing, 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 breathing. She said, Roberts, you got to remember to breathe, okay? You got to remember to keep breathing, okay? I said, yeah, I'm going to remember how to breathe. I called back Menace. I said, yo, Menace, I see how people die, Menace. They get tired of fighting.
Any one of us could get COVID. And reality will definitely set in if it comes knocking right at our very front door. be vigilant, follow the protocols that are in place. Yes, it can be a bit tiresome or monotonous, but it's for our health. And that is the most. I am concerned with the opening. I'm concerned with schools reopening because from what you're hearing, COVID could be with us for the next 2 years. We don't know. And we have to ensure we follow the protocols, the health protocols, the hygiene protocols that have been put in place for our protection. And just be mindful, be loving to other persons, be considerate, be caring as well, and always try to understand another person's situation before you judge.
What is the next step? Where do we go from here?
Continue to be safe, practice the basic public health practices and activities that we in the Ministry of Health have been preaching. Wash your hands regularly, wash your hands, sanitize, practice good cough and sneeze etiquette, obey the guidelines set out by the Ministry of Health, for example, wearing your mask. I'm not very happy with what I see when I drive, that a lot of people, I think we're becoming a little bit complacent. We're not at the stage where we still have a number of confirmed cases. So people, maybe they tend to believe that things are over and they can relax a little bit, because wearing a mask is not a normal thing. It can be a bit uncomfortable, and I guess as people become more complacent and comfortable and think, okay, well, maybe this is over, they tend not to be as vigilant with their masks and as with the hand washing as well. But I want to remind persons that these are things that are out there that we put out to protect them, and they really should continue to do them because it protects everyone.
Danarrie Roberts says it is as simple as this.
If you don't want to think about yourself and you don't care how you feel, think about others. Think about the fact of your family. Think about your friends. Think about everybody you love.
This has been Coping with COVID-19 in the Caribbean. Antigua Barbuda, we got this. Coping with COVID-19 in the Caribbean is funded by the Pan American Health Organization.